afternoon, my dear friends, colleagues, and viewers. Thank you for joining us today. Welcome to this how-to series of lockdown series that we have started about 3 weeks ago. Thank you very much for the excellent response that we have been receiving for all these series webinars that we have been conducting. This session is brought to you by CIPLA and Dentoscope Academy in association with Future Dent, FamDent Publications, FamDent Shows, and FamDent Awards. I am Dr. Anil Arora, editor of FamDent and Endodent and director of FamDent Shows and Awards. Today's session will bring to you a how-to session on how to achieve glide path in endodontics. I know in parts of Western India like Maharashtra and Gujarat, today people might be more concerned about the path of the cyclone than the path in the tooth. But then it's also a great weather to just have a cup of tea next to you and watch this session by an energetic and a young KOL, Dr. Shah. I'm joined by Dr. Samira Sheikh, who will moderate this session. She is an implantologist and prosthodontist in my clinic and an associate. She will be moderating this session, and please feel free to ask any questions on the Facebook page, and we will ensure that these are answered at the end of the session. Over to you, Samira.
Good evening, dear friends. Thank you for joining us. I hope you all are staying safe at home today. We are here today with Dr. Shah, and he'll be showing us how to establish smooth guide path in endodontics with most efficient and economical way. A brief introduction about Dr. Harsh. He is MDS in conservative dentistry and endodontics. He is director of board at IAACD. He is key opinion leader for Colteen, Micromega, and Evoclar Vivadent. He delivers lectures and conducts workshops on basic and advanced endodontics, post and core, and laminate veneers at various national and international platforms. Friends, let's learn from Dr. Harsh. Over to you, Dr. Harsh.
Thank you so much, Dr. Samira, for the kind introduction. Thank you, Anil sir, for sparing time in being here. A very good evening to all of you. Like Dr. Samira has introduced, I am Dr. Harsh. I'll be taking a short talk today on establishment of glide path in endodontics. The reason I say short talk is because generally, whatever webinars we've been attending, especially in this lockdown since the last couple of months, they've all been focused onto the lecture part of the topic. What we are actually going to be doing today is we will be discussing not just the theoretical aspects, but the practical approach as well. I'll be giving a live demonstration of 3 different techniques for establishing glide path in your root canal cases. And I'm not going to be talking about anything that's very complex, very difficult. We are going to start right from the basics. We are going to attend to the most simplest cases that we see in our practice, and then we gradually advance towards more complex cases. Dr. Samira, if you could just confirm my screen, audio and video are all fine?
Yeah, it's all good.
Perfect.
You can carry on. Yeah,
thank you. Okay, friends, so let's go ahead. Now, whenever we are performing endodontic treatment, there is very often a possibility that there are certain mishaps in the procedure that we are doing. There are certain complications, and these quite often lead to a lot of irritation, a lot of frustration, anxiety, depression, etc. Especially when you see a separation that occurs during the procedure, it's most definitely the most disheartening thing that you could have at that particular moment. So, and the primary way to, or the primary solution to take care of this problem is providing a good glide path. If you have a good glide path from the beginning of the procedure, you will definitely not have too many endodontic complications during the procedure. So the first thing that we will obviously be addressing is what exactly is glide path. We've heard this terminology so many times from so many different speakers. Most often it is in the form of complex definitions that are present in endodontic literature. In the simplest way, if I could tell you, a glide path is the preparation that you do for a root canal, wherein the only thing that you make sure is that your 10 number K file goes extremely smooth in the canal anatomy. Once this is achieved, you can safely say that your glide path has been prepared. However, glide path has been, it is not a standalone entity. There are a lot of different names that have been given to this particular terminology. Glide path is also known as slide path by some authors. It is known as guide path. So what I basically want to say here is that please do not get confused with newer terminology every time you hear them, because it's exactly the same thing. It is the provision of a smooth and reproducible path along which your instruments can slide all throughout the preparation that you are doing. So if you've understood what glide path is, what I'm saying is that from the coronal part of the root canal system to the apical third, your instrument should go smoothly, and not just one instrument. Every time that you put an instrument inside, it should enter the root canal anatomy unhindered. So let's start with a few different cases here. So the first thing I'm showing you, yeah. So the first thing that we are seeing is, I want to show you how you tackle simple cases here. Now, there is often a possibility that you will not have any difficulty in the procedure. When you see radiographs like this, you are pretty much sure that nothing is going to go wrong. This is going to be a straightforward case. And there are basically two ways to assess this difficulty, especially when you talk in terms of glide path. The first thing is the width of the canals. That is the working width, the initial working width, or you could even say the radiographic width that you see. How wide do you think the canals are from this radiograph? Like you can see in these two radiographs, the canals appear to be fairly wide. You don't anticipate any complications when you're preparing when you're instrumenting the root canals. The second factor that we consider is the curvature of the canals. So if you can see, even though in this molar there is a slight curvature, this curvature is very gradual. We don't expect this curvature to create any issues for us, especially because it is gradual and the canals are wide. In such simple cases, establishment of glide path and consequent instrumentation and obturation become extremely simple. Now let us talk about some moderate type of cases like these that you see right now. In both of these cases, you can see that with some amount of difficulty, you can still trace all the root canals right up to the apex. You don't see a lot of curvature in any of the canals, and they seem to be fairly doable. You don't expect to have a lot of complications in these cases. And similarly, with some effort, if you have prepared your axis well and if you go along the protocols, it should not be very difficult to prepare a glide path and eventually obturate this. The third type of cases I want to discuss is obviously going to be the slightly complicated cases. In these x-rays, if you see, these are both mandibular molars that we are talking about. These mandibular molars not only have severely curved roots, but they also have root canals which are extremely fine and they seem to be disappearing somewhere in the midway. When you have such cases, you can expect that your glide path preparation is not going to be as simple as in a routine case. You might come across a few difficulties. And thus, preparation of glide path and obturation both will be a little complex for these kind of cases. So we are going to the procedures that we will talk will make sure that these difficult cases also get simplified by the end of this presentation today. Now, there are a few things which you definitely require to establish glide path. And the first one is establishment of a straight line axis. If you do not have a straight line axis, glide path preparation cannot be achieved successfully. Similarly, all the instruments that are introduced subsequently will also have a lot of stress on them. Apart from this, there are a few instruments or equipments which are available which will help you in preparation of the glide path. A number 10 K file or a number 10 reamer is absolutely essential for all your endodontic procedures. You may choose to use a rotary glide path file, and you may also use a reciprocating handpiece like the K400 or the M4 safety handpiece. I'll be discussing all of these instruments in detail because that is what my presentation is mostly going to be about. Preparation of glide path using these simplified aids. The one thing that is to be kept in mind is before you insert any rotary instrument for instrumentation of the canal, you must make sure that these steps are successfully accomplished. The first one being preparation of an access cavity, obviously to reach the orifices of the canal. You will then take a number 10 K file to locate the canals. Once all canals have been located, mind you, I'm not talking about reaching the apical third right now. We are only talking of locating the canals. Once you have located all the 3, 4, or 5 canals in the tooth, we can safely flare the orifices of these two, which is known as orifice modification or coronal flaring. When you perform coronal flaring, it becomes easier to insert subsequent instruments in the root canal. Once your root canal orifices are flared, we will determine the working length and we'll be inserting a K number 10 K file right up to the apex or right up to the working length. We will then prepare a glide path, and only after the glide path has been prepared, we will be moving towards use of rotary instruments. Amongst all these steps, the two steps that we are going to discuss today are going to be coronal flaring and glide path preparation. So let's talk about coronal flaring first. Now, coronal flaring is basically preparation of the coronal 1/3 of the root canal system. So let's, for the sake of simplicity, let's just take a maxillary central incisor. In this maxillary central incisor, when I'm preparing the coronal third of the root canal, I'm not trying to enter into the middle third or into the apical third. I've located my canal. I'm going to widen the coronal third so that my subsequent instruments can be inserted very easily. Now let's see why coronal flaring is so important. The first is that it removes the interferences from the root canal system. If we talk about these interferences, sometimes what happens is there is a small shell of dentine that is covering the root canal orifice, probably partially. There may be a pulp stone in the pulp chamber which may pose as an interference. There may be certain aspects of the axis opening which are not allowing straight line access. What I mean to say here is, once you have done your orifice widening or your coronal flaring, all interferences will be removed. If these interferences were not removed and if coronal flaring was not done, there will be a high possibility of either separation of your instruments or a possibility of causing a lot of iatrogenic damage, causing endodontic complications. So please remember, coronal flaring is very important for removing these interferences. Coronal flaring also makes sure that the working length that you had established does not change. Why do I say this? In case you establish the working length before coronal flaring, you just locate the canals and you straight away jump for establishment of working length. What would happen is, when you would actually do orifice modification or coronal flaring, you would cause straightening of the root canal. This straightening of the root canal will cause shortening of the working length, and thus your working length will change. So it's important that working length is always estimated after the coronal 1/3 of the root canal has been prepared. The third important factor why coronal flaring is important is because it will allow a large volume of your irrigants to stay inside the pulp chamber as well as into the coronal thirds of the canal. This larger volume of irrigant will help you for managing the organic debris, that is your pulp, bacteria, bacterial toxins, byproducts, etc. It will also help you in the use of EDTA for taking care of the inorganic component. Once your irrigant penetration is taken care of, your irrigants can safely enter into the middle third of the root as you proceed with the instrumentation. And the last reason is, once your coronal flaring is done, a major chunk or a major bulk of the pulp tissue is extirpated during coronal flaring itself. Once the major chunk is removed from the root canal space, it becomes extremely easy for your sodium hypochlorite to act on the little remaining pulp that is left behind. Let's see the kind of instruments that we use for flaring the coronal 1/3 of a tooth. These are called as orifice shapers, orifice wideners, orifice enlargers, flare files, etc. Let's see what requirements or what are the ideal characteristics that you generally have in a orifice shaper. The file that you see here is a 1 flare, which is what I use. What I want to tell you about this file is, I'll just tell you a few points. Most of these orifice wideners have a short length. Like in this case, you can see that the entire length of the file is only 17 millimeters. Whereas the active length or the cutting length of the file is only 8 millimeters. After 8 millimeters, there is no taper. Another thing that you must remember when you choose a file for orifice widening is that you should not take a file which has a thick diameter. If you have a diameter which is thicker than 1 millimeter, there is a high chance of causing iatrogenic errors and especially of causing vertical root fractures because of loss of the pericervical dentine. So please remember to use a file like in this case, this 1 flare file has a maximum diameter of 1 millimeters. It can never go beyond 1 millimeter. So how much ever I prepare, I'm always going to be conservative. Another advantage is that these are heat treated instruments, so they cause minimum damage to the tooth structure and they have a high flexibility. All of these orifice widening files generally will have a larger taper, somewhere in the range of 8% to 12%. Orifice wideners can generally be used for a large number of cases. Like if you're using any other rotary files, you will probably want to discard them in 2 cases, 3 cases, 5 cases at the most. But with orifice wideners, you could use these in as many as 15 to 20 molars as well. Obviously, you need to check for signs of distortion. But then in my experience, 20-25 molars can easily be treated in a single orifice whitening file. So let's just see how we use these files. So this is a tooth after access opening has been done, and we can see that there is a part of dentinal tissue here which will not allow straight line access for my instruments. Just look here. My file goes completely in an oblique fashion only because of this dentinal structure here. So what we actually do is we take our orifice winding files and we use them along this wall. This file only needs to be used at a depth of 3 to 4 millimeter beyond the orifice. You don't need to go very deep inside the root canal up to the middle or the apical thirds. Once your orifice shaper has been used, you will have a straighter access in the tooth, and thus chances of iatrogenic errors will be greatly reduced. So I told you we'll be discussing two topics, orifice widening and glide path. I hope everything about orifice widening is clear. If you all have any questions, you all can put in your comments in the Facebook live that is on right now. Dr. Samira will ask these questions at the end of the presentation. So talking about glide path, before we actually delve into the details of how glide path is prepared, there is one basic endodontic motion that needs to be revised at this point of time. That is the watch winding motion. I've seen a lot of clinicians not being aware about how precisely watch winding motion has to be done. You all can log into YouTube. There are ample videos there. You can read Grossman, a book as basic as Grossman has also explained the procedure very well. In short, if I were to tell you, what you basically do is you hold your endodontic instrument and you keep going slight clockwise, slight counterclockwise, clockwise, counterclockwise, clockwise, counterclockwise. This will only be in the range of approximately 30 degrees. We will not be doing this clockwise, counterclockwise movement for a very long time or for a very large amplitude. We will only be going up to 30 degrees. So if I were to put it into perspective, just pay attention to this file here. This is exactly what we'll be doing. We'll be vibrating it slightly clockwise, slightly anti-clockwise. Remember, watch winding motion will eventually not bring about any rotation of the file. You will still be left at the same point from where you started. So the chances of separation or other iatrogenic errors are greatly reduced here. Let's go into actual glide path preparation now. There are several different instruments, materials, and techniques which are available for preparation of glide path. You have a lot of manual instruments, from things as basic as your reamers and K files to instruments which are specifically meant for preparation of glide path, like the ProFinders or Pathfinder CS, etc. And then there are rotary or mechanical instruments like path files, 1G, G files, etc. What I would suggest here is I will explain all three techniques to you and you choose what you want to do at the end. So one thing that remains common irrespective of the technique you choose is that the first file to reach the apical third will always be a number 10 file, or in rare cases a file which is smaller than this, like a number 8. But never will you proceed with any glide path preparation before a 10 number file has reached the complete working length. It does not work like my number 10 file goes 3 millimeters short. Let me just finish my glide path preparation and then I will try to achieve apical patency. It does not work that way. You have to make sure that every file that follows in the sequence will only be following the place or the level to which a 10 number K file had reached when you started the procedure. Let's discuss the three methods for preparation of glide path now. The first method obviously is the use of manual instruments with your fingers. These are your hand K files and reamers that I'm talking about. The second is the use of a reciprocating handpiece, which accepts these K files or reamers. So the same K file that you have been using in your practice, you'll be using the same K file, but this time you will not be using it in your hand in a watch winding motion. A machine will be doing it for you, and that machine is called a reciprocating handpiece. And the third method for preparing glide path is use of rotary glide path files. These rotary files basically make your job much easier. So let's just see all these three techniques. I will be discussing the use of the reciprocating handpiece in maximum detail because this is what I trust has worked the best for me. I'll discuss some advantages and disadvantages of the same protocol as well. So let's see the manual method for preparation of glide path. You already saw what we did here. Now all these glide path steps I want to just recap once for you will be done only after coronal flaring has been accomplished and working length has been estimated. Only after a number 10 K file has reached the complete working length. Once it has reached, we start preparation of glide path. You will take the same 10 number K file. You will start applying watch winding motion to this 10 number K file. Once you've applied this watch winding motion, you will realize that this file goes slightly smoothly. We are not using the file in filing motion right now. We are only using it in watch winding motion. Once this job has been accomplished with the 10 number K file, you will irrigate. You will recapitulate with the same 10 number K file once. You will achieve apical patency. You will irrigate again. So the step between any two hand or rotary files in endo, any two files will always remain irrigation, recapitulation, irrigation. Please remember this irrespective of the system of files you are using or the technique for glide path preparation that you are using. Irrigation, recapitulation and irrigation will always remain the same. Once this has been accomplished with a 10 number file, you could go to a 15 number hand file, either a reamer or a K file, and you repeat the same procedure until your 15 number file can enter the apical third of the canal easily. If you feel that the 15 number is going easily, you may choose to stop here. Or if you're a beginner in endodontics, you may choose to go up to a 20 number K file, because if you have done glide path preparation till a 20 number K file, all following steps become much easier for you. If you have sufficient experience, you can stop at 15 as well. But especially if you don't have that kind of experience, I would still advise going to 20 or 25. So that's how manual glide path preparation is done. The key steps here are watch winding motion, sequential selection of instruments, that is 10, 15, 20. Now, sometimes what happens is after 10, it's very difficult to make 15 number file reach up till the apex. So you may sometimes choose to use a 12 number file in between as well. And the third important step is irrigation, recapitulation and irrigation between any two files. So this will bring about complete glide path preparation. But what happens here is this process is very fatiguing. It takes a lot of time. It uses up a lot of energy because continuously you will be sitting and doing this motion with your fingers. Plus the glide path that you achieve at the end, it may not be satisfactory for your purpose. So sometimes we advise the use of a handpiece which can do the same thing for you. A couple of popular brand names for these handpieces. The most popular one I assume right now is the K400, which is from Bombay Dental and Surgical. These handpieces are reciprocating handpieces. They bring about the same reciprocation movement of the file. Now these handpieces can be connected either to your micromotor directly, or if you want to use it on an endomotor, you can even connect it to an endomotor. This will fit most endomotors that are present in your clinics. So this is completely your choice, whether you want to connect it to a micromotor or to an endomotor. They have both the options available. What I am using is the one that goes on my micromotor. I don't use the one that goes on to the endomotor. Now, the advantage here when you use it on a micromotor is that you have a very large selection of speeds which is available. You don't need to be restricted to a particular speed because your micromotor can go up to a speed of about 30 or 35,000 RPM. So, which is why I am more comfortable using it on a micromotor. Now, this attachment here will accept your reamers or K files. They will accept files from most brands, like I'll show you in the next slide. These handpieces are also known as gyromatic handpieces, oscillating handpieces, K file oscillating handpieces, or handpieces with symmetrical reciprocation or true reciprocation. What I mean by symmetrical or true reciprocation basically is the amount of clockwise movement and counterclockwise movement will always remain the same. It will not be doing a movement of more clockwise, less counterclockwise, or more counterclockwise and less clockwise, which means that the eventual movement of your file, the eventual position of your file will be the same as when you started. There will be no rotational forces acting on this file, which is precisely the reason why instrument separation by this technique is almost impossible. This is how the file fits onto the head of the handpiece. The file goes clockwise, counterclockwise, symmetrically, same degrees clockwise and counterclockwise. This is how the head of the handpiece looks. You press the chuck and you can use any brand of K file into this head. Most brands will be accepted here. This can accept up to 4 millimeters of head size, which is what most file handles are. One thing that I want you to remember is we don't insert the file first and then carry the handpiece to the tooth. What we do is we take the file, we insert it into the root canal up till the working length, and only then will we connect the handpiece to this file. How this helps basically is it brings about it does not cause any iatrogenic errors, especially ledges, because that is one of the disadvantages of using this kind of a system. It will only happen if you're working short of the working length, not otherwise. So let's see the exact movement that is happening here. I told you it is symmetric oscillation. It is 30 degrees clockwise, 30 degrees counterclockwise. That's how the file continuously keeps rotating. So in context, if you see, this is how the file will look like. It will go a little clockwise and then a little counterclockwise. But the file will eventually have zero rotation, which is what will cause the safety. That is why these handpieces are also called as safety oscillating handpieces. Now, there are several advantages of using reciprocating handpieces compared to your manual glide path preparation and compared to rotary glide path preparation. Let's see the manual glide path preparation first. If you were to prepare glide path preparation using reamers or K files with your fingers, and when you compare it to these reciprocating handpieces, the primary advantage remains that the fatigue on your fingers is greatly reduced. The speed is much, much faster. You will have virtually zero chances of separating an instrument in the canal, even if you were working on severely curved root canals. There is no chance of the instrument getting slipped and the patient aspirating it, even if you're not using rubber dam isolation. You will have good visibility because the size of the head of this handpiece is much smaller than the combined size of the two fingers of your hand. When you're working on wisdom teeth, the procedure becomes very simple because reaching that last tooth is extremely easy now. And once you have used these kind of handpieces, the stress on your rotary files is greatly reduced. And because the stress on the rotary files is reduced, there is a minimum possibility of, there is a maximum chance that you'll be able to use your rotary files in many, many, many more cases. So it makes your procedure extremely economical as well. Now, if you compare it with rotary glide path files, I'll talk about rotary glide path files in detail in the forthcoming slides. The primary advantage is that it becomes very economical because you don't need any extra inventory of that rotary glide path file in your practice. You do not necessarily require an endomotor. Like I told you, it can fit on a micromotor as well. So if you don't have an endomotor, if you're not even using a rotary, if you're not even using rotary instruments, you can perform entire instrumentation of root canals using this K400 handpiece. There is literally no chance of separation even if you're working in very curved canal. However, there are also some drawbacks, but all of these drawbacks can easily be tackled. The first drawback is that there is a higher chance of debris getting accumulated within the root canals. Now for this, the simplest thing that you can do is you perform good amount of irrigation. So if you follow irrigation, recapitulation, irrigation, this debris will not get accumulated. The second, third, and fourth disadvantages are closely linked to generation of debris. Because what happens is if debris is generated and you're not irrigating your root canal sufficiently, there is a possibility of apical extrusion of this debris. There is also a chance that your root canal gets blocked. Plus, if you have not carried your file to the complete working length before you activate the handpiece, there is a chance that you will cause apical transportation or formation of ledges. This does not happen if you have carried your file to the full working length. So it's very easy to take care of these drawbacks, and that is why it is my favorite procedure, my favorite technique of preparing glide path. However, if you want your procedures to be further convenient or even more faster, you can use rotary glide path files. These are rotary files which are available dedicated for the purpose of preparation of glide path. 1G is one such example of rotary glide path files. Some of the salient features I could tell you of this file is that the cross section of the file has been made in such a way, it has an asymmetric cross section, which is in which only one cutting edge is engaging the root canal wall. Two edges of the file remain free, they are suspended. How does this help me? It helps me in many different ways. The first thing is, because only one edge is cutting the dentinal wall, the file is very free to move inside the canal. There is not much of torsional fatigue that is acting on this file, because of which chances of separation or damage to the file are greatly reduced. Another advantage, and my favorite advantage I can tell you, is when you're working with a file like 1G, any file which does not have a symmetric cross section, which has this asymmetric cross section, how this helps is you have a lot of dead space available around the file. You could term this as chip space, you could term this as debris space. So all the debris that is getting collected during preparation it can easily auger out of the root canal through the orifice and not through the apex, because there is so much of space available. Plus, God forbid, if this instrument separates when you're doing your glide path preparation, just imagine the ease that you will have to bypass this separated instrument, because you will have so much of space available all around the file for bypassing the instrument. So that's how this file will rotate, and only one edge will be touching the walls. This is just one of the glide path preparation files which are available in the market, and this is called 1G. One thing I want to tell you, another advantage or disadvantage, I don't know how to put it. Like we already discussed, you remember that elephant picture that I've shown you, where we will be putting any glide path file in the root canal system only after a number 10K file has reached up to the complete working length. Well, let's go back to that. Let's say your 10 number K file did not reach the complete length and your root canal was blocked in the apical third. And you just decide, let me just put my 1G file in the canal. And you decide to put the 1G in the canal. Now, because you did not have patency in the apical third of the root canal, this file does not have a cutting tip. So this file is meant to follow the path that is created by the first elephant. That is your 10 number K file. So if you were to push it inside, it could get distorted in this fashion. Now, would you consider this an advantage or a disadvantage? I would surely say this is a major, massive advantage, because if this did not happen, if this file did not wind upon itself, the second scenario possible would be this file would have separated in the canal. So if you've not prepared your 10 number K file till the apex properly, please remember, do not use any rotary files. If you're lucky and if you're using 1G, your rotary file will just get twisted like this and there will be no harm. One other glide path preparation file that is available for simple cases where your canals are already wide, what you can do is you just prepare with your 10 number K file. You may or may not choose to go with a 15 number. You just prepare till 10 number probably. And then you could use a heat treated file with diameters or with characteristics similar to a tip diameter of 0.17 millimeter. That is the 17 number file, and 4% taper. Choose a 3 or 4% taper rather than directly going for 6%. So what happens is this file, a 1704, works as my glide path preparation files, but I can only use it in simple cases. I will not use this file for complicated cases. The reason I would use this for simple cases is my work becomes much quicker, because I just need a single file to take me right up to a 17 number instrument. The features of this file are, it has something called as anti-breakage control. What it does is, if you force the file inside, the flutes of the file get unwound, they open up. The file does not break that easily, the flutes unwind. Another thing is it has a big core in the center, so chances of separation are absolutely reduced. It has 3 cutting edges, and this is the cross section of the file. And this file has a positive, it has a positive rake angle, so the cutting efficiency is superb. So if you were to use something like a 1704 Hero Gold file, your glide path preparation becomes further simplified in simple cases. After this, you could move to your 4% or 6% rotary instruments directly. After all of these procedures are done, and once your glide path is established, you are now free to go to the rotary files of your choice. You will need to still prepare your canals to a diameter, to a taper of 4% or 6%. You choose your favorite file system, but always remember, before you go for your rotary files, it is important to first do your coronal flaring, establish the working length after the coronal flaring, then prepare a smooth reproducible glide path right up till the working length, and only then use the rotary file of your choice. And then one common question that I'm always asked is, which is the best rotary file that is available? I'm sorry, this is a very difficult question, and I don't want to get into the difficulties of answering this question, because it's a very personal choice. I may choose a different file system for an easy case and a different kind of file system for a complicated case. I may use a completely different file system for a curved canal case, or maybe for a particular case I was using say 2-shape files, and in between I feel the need for a Hero Gold file. I will feel free to mix and match different systems. So this is an individual call that you need to take. Right now we will not have answers for that. But the only and most important thing that you need to remember is that the preparation of glide path is of utmost importance. If you ask me which are the 2 most important steps of endodontics or of a root canal treatment, I would say first is glide path preparation and second is irrigation. If these two steps are sufficiently correctly done, you will not have a lot of difficulties in your procedure and you will have good success with your endodontic treatment. So that brings me to the end of my lecture part. We obviously have the demo as well after this. So in case you had any questions about the lecture, please feel free to shoot them. Give me just a few seconds so I could quickly jump into the demo arrangement so that we could straight away go into the demo. I'll keep this screen share on for a few seconds. If you want to contact me in any way, you could do that. For the presentation, just as a formality, I would just take the thanks right now. I am really thankful to FAMDent and FutureDent Academy. I'm also thankful to Dentoscope for hosting these webinars. Thanks for Sipla for sponsoring these. Many thanks to Bombay Dental and Surgical for supporting the entire session. And yeah, that's all from my side. Let's go to the demonstration. So yeah, I guess this is clear enough now. So guys, what we are going to do is I have selected a maxillary second molar here. Let me just introduce our guest for today. Yeah, so this is the maxillary second molar that I've selected today. I did the access cavity preparation just a little while back, and I've located 3 root canals. I have already done the coronal preparation, that is the orifice widening. However, I have not performed any glide path preparation. We have located 3 canals, orifice widening has been done, good access has been done. Yeah, thanks for putting that slide share off. Yeah, so the orifice preparation is done, the orifice widening, sorry, and the access preparation is done. We have carried about irrigation just about once so far. And I am sitting here with my set of instruments. Say hello to them. So what I have here right now is we have a 10 number file. We have a 12 number file. This is a 15 number file. These are all K files that we are talking about right now. And then we have a 1G rotary file. The first method of glide path preparation that I will show you is going to be the same that the first one that we took in the presentation, that is manual preparation of the glide path. Now what you do is you will never be working in a dry canal. So I will first be irrigating one canal. In these 3 canals, I will be showing you 3 different methods of glide path preparation. So I'll just irrigate this. Yes. I will take my 10 number K file. This 10 number K file, yes. So let me just take like the distobuccal canal, for example, in this case, I have a 10 number K file here. I will introduce it inside the canal. Now, because we are doing a demonstration, let me just show you how you use the watch winding motion as well. What you do is you hold it between the thumb and one finger, and you keep going slide clockwise, slide counterclockwise, clockwise, counterclockwise. This is precisely what watch winding means. So let us put it into this distobuccal canal. Now I'm putting it very passively right now, okay? And it seems to be going to a length of about 13 millimeters. But I know that this canal is a little longer than that. So we go clockwise, counterclockwise. We do not apply too much of apical pressure, but slight apical pressure is essential here. So yeah, now I can see my file coming out of the apex as well, which means that I have reached the complete length. My length should be roughly around 15 millimeters here. Let's just check. Yeah, it's 15. Yes, it's precisely 15 millimeters. So what I could say is now, every time that I'm done with my watch winding, I have a tendency, what I do is I also use my file in a filing motion like this. So when I use it in the filing motion, I'm basically smoothing out all the root canal walls. After this step, I will be using my irrigant one more time. And I just want to remind you once also, although it is out of the purview of this presentation, all the irrigation that you carry out during instrumentation will only be sodium hypochlorite concentrated. You do not need to use any saline, distilled water or sterile water in between. So I will just irrigate this canal a little bit. The next step after irrigation, like you all know, is going to be recapitulation with the same 10 number K file. So you go till the complete length of 15 millimeters. Once or twice, you may also choose to go half a millimeter beyond the apex in this case. So once this is done, I will be irrigating one more time. So that's irrigation, recapitulation, and irrigation. After this, you can move to your 15 number K file. Your 15K file, I'll just adjust the length on this 15 number K file to 15 millimeters. Yeah. If you feel that it is reaching the apical end or the complete working length easily, well and good. If it does not go till the full working length, there are specialized files which are available. Like for example, this 12 number K file here. Yeah, I guess that is clear. It's upside down. Yes. So this 12 number K file, what it basically does is, this is a middle file between your 10 and 15 because the amount of jump in the diameter is massive between a 10 number and a 15 number. So these kind of 12 number files are available. The one that you see here, the orange colored one, is a Dontix 12 number K file. So you could use this in between only if you feel the need. Otherwise, you can directly go to a 15. Once your 15 is done, you will carry out the same procedure of irrigation, recapitulation with the same 10 number K file, and then irrigation one more time. If everything has gone well at this stage, my 10 number K file should be able to go till the complete working length without any hindrances. You can see the stopper, it is reaching the full working length. If I feel that I have to apply a lot of pressure or I have to watch wind again to take it to the full length, this means that my glide path is still not complete. So that's how simple it is to prepare with a manual file. Now, if you don't want to do this manually, the second technique that we had discussed was with the use of these kind of reciprocating handpieces. A few details that I would like to share here. The handpiece that I'm using right now, this is a K400. This has a gear reduction of 10:1. In case you have any doubts about what this 10:1 means, you can just put it in the comments below and I'll try to answer this later. So this has a gear reduction of 10:1. So it will basically slow down the speed of my micromotor 10 times. So what I do is the speed at which I'm actually supposed to do my glide path preparation with this kind of a device is roughly around 2000 to 3000 RPM. I know it sounds like a very large speed. It is very fast if you think about it. But what happens is because you're using it at 2000, because you're using it in a reciprocating motion, there is no iatrogenic damage that we are expecting here. So you can comfortably go to speeds of 2000 to 3000 RPM. Now, to keep a speed of 2000 to 3000 in this kind of a 10:1 gear reduction handpiece, you will need to do your, you will need to set the micromotor speed at roughly around 25,000. So the eventual final speed on the file will be about 2000 to 3000. So as you can, yeah, as you can see, I'm just connecting it to my micromotor here. I'm not connecting a file into this. If this is clear, you can see this is the holder where the K file is supposed to go. And when I press it, it opens up. This is open, this is closed. So whenever it is open, it's very simple. I press the button, I open it, I can just insert a file. This might be slightly difficult because I told you that you're supposed to be doing this once your file is inside the tool. So let's see how that works. Let me go back. Okay, now for this technique, what we'll be doing is we'll take the mesiobuccal canal. In this mesiobuccal canal, my orifice widening is already done. I will irrigate. I will determine the working length and then I will take a manual 10 number K file first. I am introducing this K file into the canal and here I feel a little bit of a stop. So I will adjust my stopper here and I'll measure what length this is. So yeah. On my block, the length that I get is again 15 millimeters. So what we'll do is I'll insert this file. So my first 10 number K file, the first elephant in the picture has reached up till the full working length. Now you need to hold this file slightly with just one finger is okay. you take your handpiece and you will insert the file. So now what you do is you just activate this handpiece. When you activate, the file is oscillating. I'm sure you can hear it. Let me also show it to you. Yeah, let me show it to you. I'll just curve this file so you can see it much more clearly. Yeah, please. Can you see how the file is oscillating here? This is the kind of watch winding that we are talking about. Yeah, in this view, you can see how the stopper goes. Clockwise, counterclockwise, clockwise, counterclockwise, 30 degrees clockwise, 30 degrees counterclockwise. So that's how it completes that arc stop. Yeah, so I was just showing you in between. You would have kept the file inside, then you will connect the handpiece. You put it inside this mesiobuccal canal and you put it on. When you put it on, you will set it at a speed of 20 to 25,000 RPM and you start going in and out. 3-4 strokes are sufficient. I can feel that my file has prepared enough. Now, see, one advantage you can realize here is you are completing about 2000 cycles of watch winding per minute. With your fingers, you would be doing about 60 to 100 cycles a minute. So you are performing your entire glide path preparation at a speed of more than 20 times of what you would have done manually. Once my glide path, once my 10 number K file job is done, just like the manual method, I will irrigate this mesiobuccal canal. I will recapitulate with the same 10 number K file. And when you're using these reciprocating hand pieces, you will generally not need the use of a 12 number. You can directly jump to 15 number. So my stopper is already set here at 15 millimeters. I will introduce it in the same mesiobuccal canal at the full length. I will take my K400 hand pieces. I will hold this file with just one finger and I will engage it. Now what I need to do is I will again activate. When it is activated, I'll go in and out about 3-4 times faster. I'll go in and out about 3-4 times and that is about it. So my glide path has been prepared up to a number 15 K5. At this stage, I will choose to irrigate one more time. I will recapitulate with a 10 number K file. Just a moment. Yeah. I'll recapitulate with my 10 number K file and I'll irrigate with sodium hypochlorite one more time. At this stage, I will take the 10 number K file and I'll check. Does it go very, very easily right up till the complete working length? Yes, it does. In fact, I don't know if you can appreciate, it also goes about 0.5 millimeter beyond the apex. So I have good apical patency and I have a good glide path. Your glide path can be termed to be complete when your 10 number K file reaches the complete working length very easily. So that's the preparation of glide path using a K400 handpiece or a reciprocating handpiece like we call it. Coming to the third method of glide path preparation, which is the use of rotary dedicated glide path preparation files. So let me put this file here. Yeah. So this is the 1G file that we were talking about. It has a white band. The file generally, just one moment. Yeah. Let me just take it in my finger. Yes. So this was the file that I was saying that it does not engage all three flutes do not engage the walls of the dentine. Only one of the edges is going to cut the dentine. So let's see how we use this file now. For using any rotary glide path files, you will obviously require an endodontic motor. So the endomotor that we use here, that I'm using here is a Motopex. I will have to set the speed and torque for this particular file. Your endomotor may come pre-fed with these values as well. Yes. I will, okay, let's start from the beginning for the palatal canal now. We've done mesiobuccal, distobuccal. Let's go to the palatal. So I will take my 10 number K file one more time. This is only to check that I have patency in the canal and my file can reach the complete working length. So the working length of this canal on the ruler is, I expect it to be slightly longer than those. It is 16 millimeters. Yeah. So I'll be setting all my stoppers to 16 for this case. In the palatal canal here, the file goes, yeah, it is going, but with a little bit of effort. This effort is what you should not be requiring. So I will take this 10 number K file out. I will irrigate with sodium hypochlorite here. I will just carry the 10 number K file till the full working length if it is possible. I'll remove it out one more time. I will irrigate with sodium hypochlorite again. And then what we will do is we will use the endomotor and the 1G file. The endomotor and 1G file. Yeah. So I've connected the 1G. Yeah, I've connected the 1G to my endomotor. I've set the speed and torque. You can see the file is in rotation. What you do here is, now this you can do directly after a 10 number file. You don't need to go till 15 because the apical diameter of the 1G file is, the tip diameter of the 1G file is equivalent to a 40 number instrument, and the taper for this instrument is 3%. So it is very smartly kept at between your K files, which were 2%, and between your rotary files, which will be 4 or 6%. So I have adjusted the stopper at a full length of 16 millimeters here. I will be taking this tooth. I don't need to do anything. I just activate my file. It is in pure rotation right now. It is not reciprocating. I will go gradually to the complete working length. I will not push the file at any stage. I'm going very slowly. I feel any resistance, I pull it out. And yes, now you can see I'm reaching the complete working length. So if you are using a dedicated rotary glide path file, working length, glide path preparation is so simple. We will irrigate once with hypo. We will take our same good old 10 numbered K file. Just, oh, it goes so smoothly till the full working length now, which means glide path preparation has been satisfactorily achieved. So that is where you can see it is going to the full length very easily. Yes. So, well, that's about the preparation. 3 methods, you choose whatever works for you best. Manual files are going to be the slowest. I just come back. Yeah. Your manual K files used with your 2 fingers will be the slowest, but it will be the most economical as well. Use of something like a K400 reciprocating handpiece will provide you some amount of speed. It will also make it will make it much less fatiguing for you. But there is an additional cost of this handpiece that you will have to invest in. Although let me tell you, the handpiece is not expensive at all, and it lasts for a really, really, really long time. So that is procedure number 2, or option number 2 for glide path preparation. And the third option that we had was the use of rotary glide path preparation files. Although these are slightly expensive compared to the other 2 procedures, this is the technique that will be the fastest. So if you want to limit your inventory and you still want to keep speed, this is the choice. If inventory and cost are not a factor, then this should be your choice. And if you want to keep it most basic, and if you can spend more time, a little bit of fatigue is okay for you, then you can choose to do it with your 2 fingers. So that brings me to the end of this demonstration and lecture. If I could just call Dr. Samira. Thank you so much, Doctor.
Thank you so much, Dr. Harsh. Excellent demonstration, to the point and very clear.
Thank you
And
so much.
the viewers have, we have quite a few questions that are coming. Before that, I will clear my doubts first. So
Okay.
first of all, you were saying, yeah, for glide path, you insisted on using sodium hypochlorite. What about EDTA as a lubricant? Can we use EDTA?
So you can use EDTA as a lubricant. The primary advantage of sodium hypochlorite is that it will take care of all the organic matter also, pulp tissue, bacteria, etc. EDTA will not be able to do that. EDTA will only act on the inorganic material. I limit the use of EDTA to only the first few K files that I'm using. And after that, I do not use any gel form of EDTA or any cream form of EDTA. That's the viscous gel that we have.
Yes.
I don't use that for my rotary instruments at all.
Okay.
And after my preparation, my instrumentation has been completed. At the end, I will be using liquid EDTA. I will activate it, which will remove any smear layer that has accumulated on the root canal walls. But for rotary preparation, you don't really require any EDTA gels. You can safely keep your pulp chamber flooded with sodium hypochlorite, and that works perfectly fine.
But for thin canals, initially we can use EDTA.
Initially, with your K files, you can definitely use. So even when I'm using the reciprocating handpiece, I will coat these files with EDTA.
Okay. And what is the cost of this reciprocating handpiece?
So see, this is available from many different brands, but right now, especially when you follow social media on Facebook, you will see that K400, what I'm using, is the most popular. If I'm correct, it ranges somewhere in the range of 7,000-8,000, if I'm not wrong. And there too, they are giving you some instruments or something as a package with the handpiece. But I'll still insist you contact Bombay Dental for this, for the exact figures, because it's been a while since I got this one.
And for this rotary, if we have to create using the rotary instrument, so what is the speed and torque did you set your
yeah, so I'm sorry, I forgot to mention that for the 1G file that you're using, the speed needs to be in the range of 300 to 400 RPM, and you will set a torque of about 1.2 to 1.4 Newton centimeters. A higher torque is advocated for larger files, but because this is a very thin file, 14.3%, so a torque of about 1.2 is what the manufacturer recommends. If you're using some other rotary glide path file, you will need to check with that manufacturer. It will generally be printed on the packet that you receive.
Okay. And for coronal enlargement, do you advise using a hand file or a rotary file?
Always rotary. See, no other reason, but in coronal enlargement, there is a large amount of dentine that we are removing. And if you are using your hand files, if I'm not wrong, there are barely 1 or 2 orifice widening hand files that are available. There is a lot of fatigue on your fingers. You just keep rotating them, screwing them. There's a lot of fatigue on the fingers. So a rotary file would work very well for these cases, for coronal enlargement.
Okay. Now I'll take questions from the viewers. So the first question is by Dr. Dipesh Dhalla. He is saying he uses hand file SX for orifice enlargement. Is it fine?
Yes. Yeah, it's absolutely fine. If you are comfortable with using your hand SX, it's completely okay. The only thing is it will take a lot of effort. If you have an endomotor, I would suggest you to go for a rotary orifice enlargement file. Even SX is available in rotary. You have many others like One Flare that I showed you. All of these files would make your work much more quicker. So you can move to the further steps more. The faster you finish the initial steps, more time you can give to your irrigation.
Right.
So that is one advantage of using rotaries.
Okay. Next question is from Dr. Saurabh Biswas. He's saying, sir, do you advocate the use of brooches before using orifice openers?
Use of what before orifice openers?
Brooches.
Brooch. Okay. See, use of brooch is a very personal choice. Historically, everyone used to use them for pulp extirpation. These days, there are very few clinicians. I still use a brooch in a few cases when I have large canals. When I know that this tooth is not completely necrotic, I will want to use a brooch, so I remove majority of the pulp tissue in the first go itself. If you're not using a brooch, most of your rotary orifice enlarging files or coronal flaring files will remove most of the pulp in total. So it's a personal choice. What I do is vital cases, wide canals, I use a brooch. Other cases, I don't use a brooch.
Okay. This question is from Dr. Neha Modi. She is asking, in curved canal, how do you achieve glide path?
Dr. Neha, the process for achieving glide path, whether it is a straight canal or a curved canal, is essentially the same. The only thing that I'll say for a curved canal is you need to be more stringent about the protocol that you're following. You cannot take any shortcuts at all. If it is recommended to irrigate, recapitulate, and irrigate before the next file, just follow that protocol. Don't try to jump from a 10 number to a 15 number directly. Go from a 10 number to a 12 number. So that will make work easier for you. Otherwise, the entire procedure would remain the same, whether it is a straight canal or a curved canal. Another tip that I could give you is for a tooth or for a root which has a severe curvature, it is better to use nickel titanium instruments rather than hand K files, because K files are stiffer. There is a higher possibility that they may bring about some apical transportation or straightening of the canal. So to avoid these things, severe curvatures, I would prefer to use a rotary glide path file.
Dr. Mugda, she is asking you to explain about the rake angle.
The rake angle above these files. So I think this came out of perspective when I spoke about the Hero Gold files. What happens is your file always cuts dentine at a particular angle. So if this was the wall of the dentine, and that is the radicular dentine, if this is my file, now my file has blades. So these blades are basically going to shave these walls, right? This blade could either be, I think, yeah, this way you'll be able to see better. So if this is the blade, this blade could either be completely perpendicular, so it will be cutting like this, or this blade could be like this. So this is called a negative rake angle. Here, if you can just imagine, it is not actually cutting the dentine, it is scraping the dentine. On the other hand, if this file had a positive rake angle, which is like this, it would literally be going inside the dentine and it would be scooping dentine out. So this would be cutting the dentine. All the recent files, the good files that are available now, they will come with positive rake angles because these files are heat treated. To add flexibility, they have started heat treating all files. When you heat treat a file, the cutting efficiency reduces. Because this cutting efficiency is reduced, to compensate for loss of cutting efficiency, the manufacturers will give you a positive rake angle, which will bring about good cutting of the radicular dentine.
Okay. This 1G file which you are showing, for
Yes.
how many cases we can use this file? How many
It is
canals
very,
rather?
yes, it is very case dependent.
Mm-hmm.
The difficult cases that I showed you, the two mandibular molars, if you had teeth with such extreme curvatures, I would only use it in 2 or 3 canals and then discard the file.
Okay.
If I am working in easier cases, I could go up to about 4 or 5 cases, not just canals, but cases.
Okay.
As a matter of safety, I would still advise 3 cases ke baad mein you should think of discarding the
Around
instrument.
12 to 15 canals.
Yeah, you could say 12 to 15 canals. Yes.
Okay. Another question from Dr. Mugda. She is asking, are there any limitations for pre-curving when using reciprocating handpiece?
Yeah, with reciprocating handpieces, either you will not pre-curve your instruments. See, now what happens in a reciprocating handpiece, the primary advantage is the method that I explained to you. You introduce the file up till the complete working length, and then you introduce the handpiece and you activate it.
Yeah,
Because
I
of
want
the,
to know the reason for that. Why
yeah,
you have to engage the handpiece later after putting the
yes.
file? What is the reason
Why to
behind
do
that?
this? Yeah. So see, let's say I'm working on a curved canal. So I will always need to pre-curve my instrument just in the apical 1 or 2 millimeters, right? Now, if I am going to activate this reciprocating handpiece from the beginning, the angle of curvature that I have given, it will start going this way.
Right.
Now, when it is
Okay.
going
Okay.
this way, it is going to scratch dentine all along the way. If it scratches so much of dentine, it is going to cause some iatrogenic errors. To avoid these, what we do is I pre-curve my instrument. I take this pre-curved instrument up to the complete working length. Once it has reached the working length, I will just attach the handpiece. This way, I'm sure that I'm at the working length and now only this handpiece is going to watch mine.
But
So the
isn't it cumbersome to attach the handpiece inside the mouth?
it is cumbersome in mandibular third molars, maxillary third molars,
Okay.
definitely.
Okay.
It is also cumbersome when you buy a new handpiece because the spring that is present in this locking mechanism is still very stiff. So you have to apply a little extra force, but with time it
Sure.
becomes easy. It's definitely
Okay.
it's definitely less cumbersome than creating a ledge and then trying to bypass that ledge. It will
I'm
take a
sure.
couple of seconds
Okay.
extra.
Okay. Okay. Yeah, Dr. Suresh, he's asking, can flexible files from money be used in K400 handpiece? I think you said
Yeah, you
any
can.
files can be used.
Yes. So when you talk about the kind of
Yeah.
files, there are a lot of speakers or advocates of these kind of handpieces that will recommend using reamers rather than K files. They have their reasons, and all of those reasons definitely make sense. Even I would say that a reamer is better than a K file when you're using it in a reciprocating handpiece. However, talking clinically for mild, for simple to moderate cases, using a K file will also work perfectly fine. So don't worry about not having reamers and using K files. It's perfectly fine to use even K files or K flex files like the last question was.
Okay. Next question from Dr. Bhumi Reddy. He is asking, reciprocation should always be with 10 number file only?
No, Dr. Reddy, I'm not saying that reciprocation should always be with 10. If you just saw the demonstration that we did, after 10, we actually went to 15. So that's how you are supposed
Okay,
to
no,
reciprocate.
1 minute.
Yeah.
He is asking about recapitulation. Later he has commented it's not reciprocation, recapitulation. Whether
Right.
recapitulation should always be with K10.
So if you go back to dental school, we were always told that recapitulation should be done with the last file that you had used, the previous file that you had used. Now,
Yes, yes, yes.
a lot of literature is now suggesting, and I found it very practical in my experience also, using a number 10K file for all recapitulation works perfectly fine. Because what happens is now, because we are using Rotary, there are hardly any hand files that we use. 10 and 15 is probably the most that you will require for any case. So a number 10 is what you could use for recapitulation throughout. We don't use Rotary files for recapitulating generally.
Okay. Then we have question from Dr. Renu Rakhiani. She's asking, do you use H files?
Dr. Renu, my use of H files is very, very, very limited now. If you want to know when I use it, I could tell you. I use it for my working length radiographs. Let's say I'm working on a mandibular first molar, I have 4 canals. It's very difficult for me to find out on the radiograph which canal is buccal and which canal is lingual. So I would either have to take a shift radiograph and follow the slope technique, or I would use H file in the buccal canal and K file in the lingual canal. This is one case. Another case where I would use H files is when I have a very wide canal, like say I have a C-shaped canal or a young permanent tooth, a 10-year-old or a 12-year-old that needs a root canal in the first molar. These are wide canals and my rotary file cannot touch all the walls of the canal. So I take an H file and I will use it in circumferential filing motion all around the walls. So I think these are the only reasons you will ever need an H file. You will sometimes need it to retrieve gutta percha in a retreatment cases like those, but never for glide path preparation, never ever.
Next is Dr. Sudeep Kumar. He is commenting it was a very nice demo and excellent information.
So much, doctor.
And his question is, if canal is curved, then what precautions do you take to achieve proper glide path?
So I think we just covered this. When you have a curved canal.
Sorry, calcified.
Okay, calcified. See, calcification of a canal is a completely separate issue altogether, because we have learned calcification in the very wrong way. Whenever we don't have patency in the apical third of the root canal, we start feeling that the canal is calcified. I would like to reiterate here that root canal calcifications can never start in the apical third. They will always start from the pulp chamber, go into the coronal third, middle third, and then only they can progress towards the apical third. If you are coming across a blockage in the apical third of the canal, it will most probably be either a ledge or accumulation of dentinal debris in that particular area. If you have one of these conditions, especially accumulation of dentinal debris, that is blockage of the canal because a lot of debris had accumulated because you did not follow the protocol of irrigation, recapitulation, irrigation. What you need to do is you can take a C file or a C plus file. These files have cutting tips. So because these tips are cutting, they can easily puncture through the debris that has been blocked there. And you can get complete patency one more time. So, and in case it is a ledge, the procedure for negotiating a ledge is very simple. You pre-curve the instrument. You will have to spend a lot of time here. You need to have a lot of patience. This pre-curved instrument you will be putting inside the canal till your file does not drop till the complete.
Thank you everybody for joining us, and I look forward to seeing you again on Friday for the next in this series of How To. Till then, take care, stay safe. Bye-bye.
Bye.